Hi folks, my name is Scott. I'm with Small Business Health Insurance Advisors. I'm here in our physical office in Wake Forest, in luxurious Wake Forest off of 98. If I got in my car, I would leave, make a right, quick U-turn and make a left. Wegmans is right there just to kind of give you an idea of where we're at, okay? Here to talk to you a little bit about Medicare. A lot of folks, I've been doing Medicare for well over 15 years. It is a very complex and confusing subject. If I really dove into it, this would probably be like an hour video. So I'm gonna try to not go into too much detail and just try to give you all the basics and a general understanding of how it works, okay? There are 4 parts to Medicare. Some of this you may have heard, A, B, C, and D. Now, parts A is the hospital, B is the doctor, D is prescription drug coverage that goes with original Medicare. I should have wrote that down, original Medicare, that's important. These 3 go together, we'll say like turkey and stuffing, okay? Then we have something else over here called Part C, MA, or Medicare Advantage. So when you turn 65 or you're new to Medicare, depending on your situation, you may get it earlier because of a disability, or you may wait because you're working later or whatever. So I don't want to say 65 exactly, but we'll say 65 for the vast majority of people. And here's where it gets confusing. You have 2 choices. Choice number 1 is, and I'm gonna write it down this time, original Medicare. That's important. Original Medicare is that red, white, and blue card that you've probably seen your parents have, your aunt, your uncle, etc. It's a white card with blue and red trimming around it, and it says Part A, hospital, Part B, doctor. That is original Medicare, okay? Your other option is to waive your rights to original Medicare and transfer them over to a private insurance company, such as Humana, United Healthcare, Blue Cross Blue Shield. Now, this is really important, folks. If, for whatever reason, you decide to get a Medicare Advantage plan, you are not on original Medicare. Now, I've gone to see hundreds and hundreds of people in my life, and there are times when they have already purchased a Medicare Advantage plan. And I will tell them, Mr. Smith, Mrs. Smith, do you understand that you're not on original Medicare? And they will say to me, listen, Scott, you look like a nice guy, but I don't think you know what you're talking about. And I'll say, well, what do you mean? I don't understand. They'll go get their wallet, they'll go get their purse, and they'll show me their Medicare card. And then they'll show me their Medicare Advantage card. They will even tell me, look, here's a bill that I paid for Medicare. What do you mean I'm not on it? Then I will say, well, let me ask you this, Mr. Smith, Mrs. Smith. When you go to the doctor or the hospital, you get a bill in the mail, an explanation of benefits, an EOB. Is it from Medicare or is it from the Medicare Advantage company? Did I mention it? It's not from Medicare, it's from the Medicare Advantage company. Now, they're starting to think maybe, just maybe, I know what I'm talking about. They go, I don't understand. It's not your fault, folks. Most people do not understand that they keep paying for Medicare, but instead of getting 80% coverage for Medicare, Part C and Humana gets their money. And they run these fantastic commercials where they talk about you're getting extra benefits, suntan lotion, sunscreen, Band-Aids, they might even give you money back, etc., etc. If you want to go that route, that's fine. I'm not here necessarily to beat up Medicare Advantage. I just want you to understand that you are not on original Medicare, because I think out of the hundreds to thousands of people that I've met who had Medicare Advantage, maybe 1 or 2 people understood that they weren't on original Medicare. They don't come and take your card. If you've ever had a credit card in your wallet with no money on it, you have the card. The card is still valuable because you still are a Medicare customer. You're still a Medicare recipient. Either way, whether you do this or not. I'm not saying you're not a Medicare recipient anymore, but you are transferring your Medicare rights, options, and entitlements over to Humana. And what do you get for that? Typically, an extraordinarily low premium, but then you get nickel and dime to death with out-of-pocket expenses. So they also have very, very small networks. So how can I try to put this in perspective? If you go to a doctor that takes Medicare, they may or may not take your particular Medicare Advantage plan, but it doesn't go the same way in reverse. In other words, if they take Medicare, they may not take your particular Medicare Advantage plan. But if they take your Medicare Advantage plan, they definitely take Medicare. So the point that I'm trying to get across here is with original Medicare, you have a lot more options in terms of doctors and hospitals. These are all done by very small networks. They're even done by county, Franklin County, Youngsville. So if you live in Zebulon and you live in a different county and they take you to Wake Med, now you could easily be out of network and have out of network expenses. So we'll continue this another time, but just getting back down to here, your two big choices are original Medicare, which is parts A and B. You can add D, which is prescription drug coverage, okay? Doesn't cover everything, we'll say 80% it covers. So you do need a Medicare supplement. You've probably heard the term gap insurance, Medigap. This helps pay the 20% that Medicare does not cover. That's an option for you. Or, and I'm gonna put a big or here, you transfer your rights, all the years that you were working, and you paid FICA taxes to get original Medicare, you throw it all away, throw it off to the side, and participate in a Medicare Advantage plan, typically because they say we're gonna give you a gym membership and Band-Aids and this and that, and a lot of times they're very, very inexpensive, sometimes even have a zero premium, but then you get a whopping bill. Another point of distinction is these plans are annually renewable. So if you get one, they're gonna send you a book that's about that thick, and you probably won't read it. And then the following year, they're going to change networks, change the formularies on the drugs, make a bunch of changes because they're allowed to change the plan willy-nilly because it's annually renewable. In other words, it is what it is. It is not that. Where original Medicare is guaranteed renewable. So if you buy a Medigap plan to help pay the 20%, that plan never changes. It's a standardized plan. The company that you purchase it from, there are different companies that sell them. They sell different plans, but if you buy, say, a Plan G from Blue Cross Blue Shield, or from Aetna, or United Healthcare, or whatever the case may be, it might be a couple of dollars more, a couple of dollars less, but the plans are identical, it's standardized. It makes no difference. In other words, well, I have a G plan. Tell me about your G plan. They're the same. It's like buying Campbell's chicken noodle soup at Target for $2, Wegmans $3, a gas station off the side of the road for $5. The price is different, but they were all made at the same place. That's it for today. Thank you.